I remember being really worried that I would be told that I wasn't able to dance. I remember specifically an injury that I had in college where I had to perform that night. I had to go on stage. And I was able to get in with a physical therapist the same day. I remember just being so grateful that there was somebody that had the expertise to help me out at that moment when I really needed to be on stage. Being able to do that for dancers and performing artists, I think that that's really essential.
We really understand what a performing artist may be going through and what those specialized demands are. We were in their shoes once. I think that's really helpful.
We see dancers from all different backgrounds, all age groups, all genres. Even people who are recreational, instruments from string to piano, drums, really anything across the board that people do either recreationally or professionally and have issues related to that they want to have addressed just to improve their performance, improve their technique, have less pain, function better. All of us who are involved have really made an effort to be able to provide care that's tailored toward performing artists. So really knowing what type of conditions tend to be common among various performing artists. Really with dancers, it's mostly the lower extremity that's most commonly injured. And so with any kind of lower extremity injury, almost always it feeds up to the spine.
I was dealing with a chronic injury and I was just kind of living with pain. I was feeling a lot of pain in the front and the back of my pelvis. And then, it's all connected. So for me, then it was starting to affect my lower back. So it was dance specific, but it was just really, the quality of my life wasn't really great.
Dancers want to dance. Iyun choreographs quite a bit on his dancers and teaches, and so we really wanted to make sure that he was able to do everything with minimal pain and limitation.
We've realized it would be easiest for patients to schedule an appointment with her, but for us to see the patient together so that I could be there to provide some input from a physical therapy perspective. It's a lot of what I talk about in a physical therapy session is how do you do things with proper technique, and that also speaks to the importance of specialized care too. Going to see somebody who can understand what that proper technique actually looks like.
There's just a depth of understanding, and really importantly, they understand the anxiety about us getting healthy again. So they're able to negotiate the balance, right? Where they can say to us, hey, you can do these things so you can keep working, or maybe adjust the way you're working. So I've been working with Rosie for the whole school year, and I can go days now, 3-4 days, and not have pain. And when I do have pain, before it gets to the point where it's so inflamed that I have to stop, I know what I need to do to keep the pain at bay. It is actually quite radical for someone to say to you, hey, do these exercises and it will change. And over the course of, a month, something that's been bothering you for 2 years almost disappears. It's significant.